Have you ever wondered why some small group sessions spark deep learning while others fall flat? Hi, I'm Amy Gardner, Associate Dean for Faculty Development and Director of the Academy of Medical Educators here at the University of Colorado School of Medicine. Spend a few moments with Dr. Miriam Post, Professor of Pathology and Assistant Dean for Faculty Affairs here at the CU School of Medicine, and explore practical strategies to make your small group teaching effective, engaging, and learner-centered. Let's dive into the art and science of small group facilitation.
Picture this, a group of learners huddled around a case study, debating diagnoses, challenging each other's reasoning, and building knowledge together. This is the power of small group teaching, a dynamic, learner-centered approach that transforms passive listeners into active participants. In an era where clinical reasoning, communication, and teamwork are as vital as textbook knowledge, small group teaching is not just a method, it's a mission-critical strategy for developing competent and compassionate healthcare professionals. And the science supports it. Research consistently shows that small group teaching enhances critical thinking, retention, and professional identity formation in medical learners. But how do we go about successfully implementing these small group teaching sessions, and where do we start? Hi, I'm Miriam Post, Professor of Pathology, Assistant Dean for Faculty Affairs, and a member of the Academy of Medical Educators here at the University of Colorado School of Medicine. Today, I'm thrilled to be able to share with you some of the helpful strategies I've adopted into my teaching to maximize learning in small groups. The first tip is to create a safe and inclusive environment. Psychological safety is foundational. Begin sessions by setting ground rules for respectful dialogue and encouraging all voices. Use names, make eye contact, and validate contributions to build trust. Encourage that any and all questions be voiced. When learners feel safe, they're more likely to take intellectual risks and engage deeply. Use structured, case-based activities. Design sessions around real-world clinical scenarios that require analysis, decision-making, and teamwork. Tools like problem-based learning and case-based discussions not only contextualize knowledge, but also mirror the collaborative nature of clinical practice. Provide guiding questions, but let learners lead the exploration. Facilitate, don't dominate. Your role is to guide, not lecture. Ask open-ended questions, redirect discussion when needed, and encourage quieter learners to contribute. Resist the urge to fill the silence or jump in with the answer. Let learners wrestle with uncertainty. This struggle is often where deep learning happens. Adapt to group dynamics. Every group is different. Some may need more structure, others may thrive with autonomy. Be observant and flexible. Use quick feedback tools like 1-minute reflections or anonymous polls to gauge engagement and adjust your approach in real time. And finally, reflect and debrief. End each session with a brief debrief. Ask learners what they learned, what challenged them, and how they worked as a team. This reflection reinforces learning and helps learners develop critical analysis and interpersonal skills essential for future practice. Small group teaching is more than a pedagogical technique. It's a powerful way to cultivate curiosity, collaboration, and clinical competence. As a medical educator, your ability to facilitate these sessions with intention and empathy can profoundly shape how our learners think, communicate, and care. In small groups, big learning happens.